Hi, I'm Dr. Dan Sindelar, and think about it. How many people suffer from headaches? And we as dentists have a real important role in helping people relieve those headaches. We can really give them some simple ways in our practices that can reduce their headaches. If you ever go through the grocery store line or the pharmacy and look at the area where they sell pain relievers, it's huge. And that's all because people have headaches. So I revisited this because I've offered solutions for this for some time, but sometimes you get out of the habit of asking. And this basically says, do you suffer from headaches? Your dentist has a simple solution. And we really do. There are so many ways we can help. A lot of headaches are caused by stress and the outcome of muscular stress and clenching and grinding, and that stays with the person the next day. And I mean, this even says there's as many as 23 million Americans who suffer from migraines, and 44 million Americans suffer from chronic clenching and grinding, which often results in tooth damage. So we have ways in our practice that we can really reduce this and help people once again in ways that helps their overall health and their overall life. Some of the solutions we use in our practice are any kind of bruxism appliance, but specifically, I personally really like the NTI. The science behind it is very advanced, and it really does allow us to have a simple option for patients to relieve the effects of grinding and clenching throughout the night. Originally, the NTI was brought out as the marquee treatment for migraines, and dentists are allowed to treat in that area, and also just headaches in general. And there's so many people that are being medicated for headaches, and here with a simple NTI, you can keep them from taking all the medications that can complicate the rest of their life. Tylenol, a lot of use of Tylenol can really cause some problems with liver damage and kidney problems. And some of the pain relievers now, they are really causing some side effects. We have no idea what's going to show up in research coming forward. So take some simple steps. It's real easy to treat patients for headaches with an NTI. Simple impressions. We all know how to do that in our sleep. Then go ahead and prescribe those, send it off to the lab, fit it, give the patient some simple instructions. A lot of times this is carried out by team members, and this is one of the simplest, quickest ways you can treat something that affects people's lives and their overall health right away. Basically what the NTI does, I do this explanation to patients, but when you clench at night, your muscles are tight and the muscle fibers are able to tighten up. I can do this forever. And if I'm clenching at night, I can do that too. Now, I'm going to get sore then after a while in here, and those muscles are going to get very tender. Well, what we do with an NTI and with any bruxism appliance, but especially the NTI because it fits over the front teeth, you take and you open that bite. Now, you're going to see that within a short period of time, and that wasn't as long as I wanted it to be, but your muscles will start fatiguing, and they don't want to do that. Same thing goes, when you open that bite at night, the muscles get tired of it. They don't like doing it, so you don't clench. So it's a pretty simple way to approach it, and they say 70 to 80% of all TMJ problems are eliminated with a bruxism appliance similar to an NTI. If you have a patient that still has problems, then they're probably going to be treated in a more advanced way, either by yourself or by a specialist. But always go to the NTI first, and this is something you can do right away. It's a simple way to add layers to your practice. Once again, you're doing good things for people. They will love you for it, and also it is a way to add some increased revenue in your practice.